Welcome to PEP Talks, a patient experience podcast where we share stories of promise, our culture of connection and care. This past year, we've had the privilege of hearing our patients share their heartfelt stories, showcasing incredible courage and resilience during challenging times. We're deeply inspired by the respect, care, and compassion demonstrated by our team members. It's often the smallest acts that make the most significant difference in the lives of our patients and their families. We invite you to take a moment to glimpse these impactful stories reflecting the true essence of our promise and the care we strive to provide every day.
One of the feelings that I most had difficulty dealing with with my disease and while I was sick was the loss of control, the loss of independence. I used to be a diplomat, so I lived all over the world, had to figure stuff out on my own in places where I didn't even speak the language. And I managed to, not do bad. But then I got sick and all of a sudden I lost control of everything. And I remember sitting in the thoracic oncology clinic waiting lounge. I was not happy sitting next to my parents. I was not happy feeling that I had no control in absolutely anything. And then a nurse came up to me. She didn't come up to my parents stood up and she didn't address them. She addressed me. And she asked me, "Who do you want to meet with the doctor? You can go by yourself if you want." And it's a silly question now that I think of it. It's not even that big of a deal. It sounds normal and commonplace and ordinary. At that moment, I felt like that nurse threw me a lifeline. She saw me struggling. She saw me in a hole, and she said, "You can make this decision. You are empowered to do so. You're not your disease. You're not your medications. You are your own person." For me, that one moment was a game changer, because it's the first moment I remember that I finally took charge of my treatment and my disease.
The things that we took away with us were probably not things anybody would have thought were the most important things, by far. But what we go home and write on Facebook about, or tell people at church, or brag to other people about, is the care that we got at Moffitt. And I think there's a difference between treatment and care. Treatment is, you're going to get this drug for this many days. The care is when they're listening to you and they understand how you feel and they ask how you feel. And sometimes it takes a whole team to fill in those gaps. Not any one person, some are better than others, but that's a complete package. That's hard to come by, somebody that can do all of those things. We found it at Moffitt, though. Every little thing you do for a patient is so important. We really take it to heart. You are the face of Moffitt, and when we leave here, that's what we remember, is how you treated us.
Doctors and nurses, especially our first visits, make sure, even when I was next to my dad or my husband and we could translate, but they always make sure that we will use an interpreter service. And when they talk, three of them. The Dr. Tan is always looking at my dad, is talking to him, looking at his eyes, and making eye contact. A little bit later, he used to that. And he's like looking at Dr. Tan and talking back to him, and you just can hear the voice of interpreter that it just between them. But yeah, I appreciate that they always treat my dad and makes him feel involved and special, and that he's important, that they want to make sure that you are totally aware of the situation, that you totally understand what's going on, and that you will make your own decision related to your health, that we can be next to you, but you're in charge. Yeah, people who work in here, it's every day you have another person with a cancer, who is struggling, they don't make this as like routine, yeah? They still have that light and kindness to see you as a person and see your story that for you it's a huge today, yeah? It's maybe the biggest challenge of your life. People are so dedicated. This is process of recovery. Is you're fighting, but you are not alone. I don't have enough words to express what all people from the Moffitt Center made for my family, yeah? They not just do their work like every day, yeah? They do magic.
I actually found it more difficult to recover from depression and the addiction multiple times than it was to recover from cancer. If it wouldn't have been for those nurses who somehow understood where I was coming from, even though they most likely did not experience that themselves ever, probably knew somebody or a loved one with the same kind of difficulties in their life. And they lifted me up so that I started to feel like I want to get better. And I can't tell you, how much that plays into your recovery, but I'm going to guess it plays a whole heck of a lot. Because my heart started to beat a little faster, like just with a little more joy. And part and parcel, that is primarily credited to the remarkable people at Moffitt Cancer Center who treated me like a whole person. They respected me for having gone through what I did in the past rather than judged me. They talked with me about things rather than to me. But with the staff coming in and scribbling on whiteboards and nurses greeting you, not in any annoying capacity, mind you, they'll give you time to rest and sleep, but with their gentle visits and their compassionate approach, I became sort of resurrected. I don't know. I'm excited to live life. I am privileged to be aging.
The doctor who was doing the biopsy, Dr. DuPont, agreed to meet with my husband and me at 7:30 the next morning. And she was lovely and kind and gentle. And she did the biopsy. And then she was showing us the views of the mammogram. That's when she said, based on what I see here and based on what I know, you should prepare yourself for a diagnosis of breast cancer. Now, I consider myself to be a very rational person and a very positive person. But at that moment, I just felt this volcano inside, and I knew I was going to erupt, and I lashed out at her. And I said, "Why did you just say that? How can you say that? What kind of doctor are you?" I was very rude. And to her credit, Dr. DuPont just watched me, looked at me, saw me, very gently deflected all that anger which I was hurling at her, and somehow looked at me without dismissing me and without reacting to me in an angry way. She just looked very calm and compassionate, and she said, "You are right. And I will be in touch with you later today." And if I can remember that, when people are lashing out at me, that usually it comes from some deep place of tremendous fear and feeling out of control, then it gives me the strength to say, this is not about me. I think it is great that we get to practice on a daily basis, showing compassion to our patients and being able to realize that they're coming from a place where they need to be held, if you will, in an environment that is supportive and compassionate.
When I first came to Moffitt, it was on August 21st, 2018, and I can tell you I was more like a deer in the headlights, just not knowing where to go and feeling more than just a bit overwhelmed. I first went to the information desk inside the Gold Valet, And I met a tall, kind gentleman named Stuart, and he had a big, warm smile, and he took the patience and the time to help me find all the locations that I would go to that day. And, as I think back now, he didn't know much about me or all the anxiety and the stress that he was able to relieve from me that day and make me feel like someone like family. All along on my journey, and especially during the outpatient bone marrow transplant process, where I would see Stuart nearly every day, he always gave me a big smile, and he was one of my biggest cheerleaders and encouraging me each day. The specific ways to make a difference in the patients' lives and is just to recognize them as individuals that are needing some hope, some love, some guidance, and that may be just from a smile or just answering a simple question, but you just never know how endearing that can be to the person you're talking to, that that may change their life direction, just that simple smile. I found that in Stuart, that one first positive experience, just became the stronghold of my entire life.
I was a mess in 2010 when it was back again, and I really didn't know how I was going to come back from head, lungs, liver, soft tissue, bones. I thought, I'm done. This is the beginning of the end. The biggest crux I think I had, right, was, do I sit on the sidelines and cheer everybody else on as they reach their milestones and their goals in their life, or do I get in it and live it? I said, I want to be a mom. That is explosive to everybody because I got to work it out with my social worker. My argument became, living is for the living, and nobody knows how long they're going to live. And so I did. And now my daughter's 16, and I'm married 18 years. And just think, if I didn't do that, I would have had 18 years of wondering, I woulda, shoulda, coulda. But because my social worker sat with me and hashed it out and asked me the right questions to draw the right thing out of me, where would I be?
I know I was at the point where every day they were saying, you might be discharged. Like that was some kind of, and it probably is great news for somebody whose husband's sitting right there and, their lovely cozy home is awaiting them and their caregiver and all that. But it horrified me, and I thought, you've got to be kidding me. I didn't even think anybody else was seeing that. I don't know. I didn't really think it was their problem that I was alone. And this nurse, Angel, Lauren, she came around. She got down on her knees right next to me, and she just said, I see the fear in you when they start to talk about sending you home. And it validated that someone else saw what was going on. She understood that there wasn't anybody there. She saw me when I was just so in peril. And sure enough, her words stood, they didn't let me fail. And I got what I needed. The care and the connection, the family, the support system. I was not alone in this. Moffitt, this was like my ship that came in. I wasn't going to be left adrift.
My mom had to be on campus at 5:30 that morning for pre-op. I was just worried about my mom and her getting through this surgery and how much longer I was going to have with her. And when we pulled in, the first thing that we saw was the trans-inclusive pride flag front and center. And it felt so relieving. It felt like we were being seen. It felt like as a family, we were seen coming into the entrance. That it wasn't just cancer patient number X coming in, But Gloria, you and your daughter-in-law who are coming in to support you, we see you and we value you. I think we came in with the assumption that we would not necessarily be supported in this space. And walking onto Moffitt's campus and seeing those symbols changed our understanding of the climate here in this organization, in this setting, that we felt safe and we felt that we could be a strong, loving, supportive family to help my mom in her recovery, which is what we were here for, and that was the most important part.
Hi, my name is Jasmine Cherry. I work in the cell therapy facility here at Moffitt. So anything that's like cutting edge that isn't quite standard of care yet, I get to work on with my team. My white blood count was really elevated, which are like classic indicators of that something is wrong. And just from working where I work, I saw those numbers and I just had a really strong feeling of what it was. I actually got a phone call from the oncologist and she was confirming that just from the preliminary test that it is cancer, it's leukemia. Apart from my family, the whole cell therapy facility as a whole supported me through this from the beginning up until the end. So for bone marrow transplant, the day that you get your cells, they call it your second birthday. So that's your day zero of remission. So December 2nd, 2022 was when I received my brother's cells. So I came back to work, and December 2nd of 2023, my coworkers threw a surprise birthday party for me. It was super sweet. They decorated my desk. I had hot dogs. I love hot dogs. So we celebrated my second birthday that day, and then I had my actual birthday this past February where I was able to celebrate another birthday thanks to Moffitt. I turned 27, so I'm really happy to see that, because without the options that I had here at Moffitt, without being able to be treated at Moffitt, I wouldn't be here right now.
So Jeremy is the concierge in the radiation departments. That's the first person you see. The moment you get your wristband and you walk through the doors and you see this young guy behind a desk or kneeling, talking to one of the patients, you realize it's kind of a special place. Wait a minute, this is a hospital. How do they have a concierge? The young man is a remarkable listener to people. He really gets a sense and can size up each individual's needs at the right time to deliver the best kind of care. And what best first impression for somebody that's anxious, nervous, and afraid to spend 10 minutes, 15 minutes on the radiation table than to get soothed and calmed by Jeremy's care. There was no variance in his treatment of a patient. They all got the best treatment. So that's why, he immediately comes to mind when I think of Moffitt. Why do you think of Moffitt first? Jeremy's face lights up in my head.
There is something about this place that is unique. I've been to different cancer centers and seen different approaches and seen very caring people working in oncology. But there is something about the way things are done at Moffitt. You can tell that your hiring is not just for skill, but for value fit and culture fit. And that dedication to patient-centered care, patient and family-centered care, really comes across, and for us it came across from day one. So if I had the opportunity to speak to team members as a whole, regardless of whatever their role is, this is what I would tell them. I don't know if they realize that from when you walk up and drop your car off, if that valet is upbeat, and 99.9% of the time they are, and says hi and opens the door for you and takes your key, and then you walk in and you check in, and those people are upbeat, and you develop a relationship with them. And then you go back with your MA, and the MA is another touch point, making you feel cared about as a person. Then you're with your nurse, then you're with your provider, then you go to the cafeteria, then housekeeping or environmental services is coming through, and they're talking to you and asking how you're doing. I don't know if they realize individually how much that makes a difference, because it's the aggregate of all those positive acts over the course of a day's visits at Moffitt that changes how you feel about that experience. That you come out of here, even though it's hard, even though sometimes it's depressing, but you come out of here feeling cared for and acknowledged as a fellow human on this planet.
Thanks so much for listening. We hope you'll join us for our next episode of Pep Talks. Until then, keep living the promise.